Hey everyone, and welcome back to the channel. Today we're demystifying a really important health test, the 2-hour oral glucose tolerance test, or OGTT. You might have heard about it from your doctor, especially if you're at risk for prediabetes or are currently pregnant. But what exactly is it, and what do the results mean for you? Stick around for the next 10 minutes as we break it all down, step by step, in a way that's easy to understand. First off, why does this test even matter? Well, did you know that millions of people have prediabetes and many don't even know it? The OGTT is one of the best tools we have to catch it early. It's a test that shows how well your body processes sugar or glucose after you consume a specific amount. Think of it as a stress test for your metabolism. It helps your doctor see how efficiently your body's insulin is working to move glucose from your blood into your cells for energy. So, what is the 2-hour OGTT, fundamentally? It's a simple but precise process. After an overnight fast, you'll have your blood drawn to get a baseline glucose level. Then, you'll drink a sweet, syrupy beverage containing 75 grams of glucose. After that, you'll relax at the lab for 2 hours, and then they'll draw your blood one last time. By comparing the before and after blood sugar levels, your doctor gets a clear picture of your glucose tolerance. Who typically needs this test? Your doctor might recommend an OGTT if routine blood tests show borderline high blood sugar. It's also commonly used if you have risk factors for type 2 diabetes, like a family history, being overweight, or having a sedentary lifestyle. And, as we'll discuss in more detail later, it's a standard screening test during pregnancy to check for gestational diabetes, which is a temporary type of diabetes that can develop during pregnancy. It's all about early detection and prevention. Now let's talk about preparation, because doing this right is key to getting an accurate result. For at least 3 days leading up to the test, your doctor will likely advise you to eat your normal diet with a good amount of carbohydrates. This primes your body to respond correctly. Then you'll need to fast for 8 to 12 hours before your appointment. This means no food or drinks except for small sips of plain water. Also, avoid alcohol and strenuous exercise the day before the test. And one last important tip. Make sure you talk to your doctor about any medications you're taking, as some can affect the results. All right, it's test day. What can you expect? Let's walk through it. You'll arrive at the lab or clinic first thing in the morning, having fasted overnight. A phlebotomist will draw your first blood sample. This is your fasting or baseline glucose level. Next, you'll be given the glucose drink. It's usually a very sweet, syrupy liquid that you need to drink within about 5 minutes. It's not everyone's favorite, but it's manageable. Once you've finished the drink, the clock starts. For the next 2 hours, you'll need to rest quietly at the lab. No running errands, no smoking, and stick to just water. Bring a book or some headphones to help pass the time. After exactly 2 hours, you'll have your final blood draw. And that's it. You're done. You can eat and drink normally afterward. So you've done the test. What do the results mean? For adults who are not pregnant, the numbers are pretty straightforward. Your 2-hour blood glucose level is the key indicator. If it's less than 140 milligrams per deciliter, or less than 7.8 millimoles per liter, that's considered normal glucose tolerance. Great news! If your result is between 140 and 199 milligrams per deciliter, that indicates prediabetes. This is a warning sign that you're at increased risk for developing type 2 diabetes, but it's also a crucial opportunity to make lifestyle changes. A result of 200 or higher means a diagnosis of diabetes. Now, for expecting mothers, the process and the numbers can be a bit different. The OGTT is the gold standard for diagnosing gestational diabetes. The most common approach is the one-step 75-gram OGTT. You'll have 3 blood draws, 1 fasting, 1 at the 1-hour mark, and 1 at the 2-hour mark. Gestational diabetes is diagnosed if even one of these values is at or above the specific thresholds. For fasting, it's 92 milligrams per deciliter. At 1 hour, it's 180. And at 2 hours, it's 153. If you're diagnosed, don't panic. Your healthcare team will work with you to manage your blood sugar to ensure a healthy pregnancy for both you and your baby. Let's touch on side effects and safety. The OGTT is a very safe routine test. The most common side effect is feeling a bit nauseous, dizzy, or sweaty after drinking the sugary solution, especially on an empty stomach. This usually passes quickly. The risks from the blood draws are minimal, just a little pinch and maybe a small bruise at the site. If you feel unwell at any point during the test, just let the lab staff know right away. They are there to help you. So what happens after you get your results? If everything is normal, fantastic. Keep up your healthy habits. If you're diagnosed with prediabetes, this is your wake-up call. Your doctor will likely recommend lifestyle changes like a healthier diet, regular physical activity, and weight loss if needed. These changes can often delay or even prevent the progression to type 2 diabetes. If you're diagnosed with diabetes or gestational diabetes, your healthcare provider will create a personalized management plan for you, which may include diet, exercise, blood sugar monitoring, and sometimes medication. To make sure your results are as accurate as possible, let's recap some key tips. First, follow the fasting instructions perfectly, 8 to 12 hours, water only. Second, eat a normal diet in the days before. Don't try to cram for the test by suddenly cutting carbs. Third, tell your doctor about all your medications and supplements. Fourth, during the test itself, rest and don't eat or drink anything other than water. And finally, make sure the test timing is precise. The blood draws need to happen right on schedule. We're almost at the end, so let's do a quick Q&A. A common question is, does the drink taste bad? It's very sweet, but most people find it tolerable, especially if it's served cold. Another one, can I just use my home glucose meter instead? No. The OGTT is a standardized diagnostic test that's much more precise than a home meter. And lastly, what if I get sick and can't do the test? Just call your doctor's office to reschedule. It's important to do the test when you're feeling well, and that's our comprehensive guide to the 2-hour oral glucose tolerance test. I hope this explainer has made the process clearer and less intimidating for you. Remember, knowledge is power when it comes to your health. This content is for educational purposes only and is not medical advice. Always consult with your healthcare provider about your specific situation. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more clear, simple health explainers. Hit that notification bell so you don't miss our next video. Thanks for watching and take care.